everyone. Welcome back to the Deep Dive.
It's great to be here.
Today, we're going to be tackling a topic that I know a lot of you are interested in, and that's integrating mental health into primary care.
Yeah, this is a really important issue.
It's a big one, and honestly, it touches all of us in some way.
Absolutely.
We're going to be using a fantastic report from the World Health Organization as our main source.
I'm familiar with that one.
It's called Integrating Mental Health into Primary Care, a Global Perspective.
Great report.
Plus, we've got a bunch of other academic articles to give us a well-rounded view.
That's good.
What we really want to do is equip you with a solid understanding of the challenges,
Right.
the successes,
Yeah.
and especially some real-world examples of how integration can and is working.
It's inspiring to see what's happening out there.
So are you ready to dive in?
Let's do it.
All right. The WHO report doesn't sugarcoat things.
Yeah, it's pretty direct.
It says that mental disorders affect a staggering 1 in 4 families worldwide.
Wow.
1 in 4.
That's a huge number.
Think about that. Statistically speaking, 1 out of your 4 closest families is likely dealing with a mental health challenge.
That really puts it into perspective, doesn't it?
It does.
It underscores that mental health challenges are everywhere.
Right, and these disorders, they don't discriminate.
No, not at all.
They affect people of all ages, from
Yeah.
all walks of life.
Rich, poor,
Exactly.
urban, rural.
It doesn't matter.
It really drives home the point that this isn't some other group. This is all of us.
This is all of us, yeah.
And it's crucial to remember that these numbers aren't just statistics on a page.
No, they're real people.
Exactly.
They represent immense suffering,
Mhm.
disability.
And sadly, even people dying younger than they should. Absolutely. That's the really tough part.
It is.
So given the scale of this issue,
Yeah.
why is focusing on primary care so important?
Well, think about it. For
Okay.
many people, primary care is their first and sometimes only point of contact with the healthcare system.
Yeah, that makes sense. It's the most accessible,
Right.
often the most affordable.
Mm-hmm.
And honestly, for a lot of people, it's the most acceptable way to get help, especially in places with limited resources.
So it's about meeting people where they're at, both literally and in terms of what feels comfortable for them.
Exactly.
That's smart.
Primary care is a great setting to promote early diagnosis, which, as we know, is really key for mental health.
Early intervention is so important.
Yes, and it also encourages a human rights-focused approach to care.
I like that.
And that helps people dealing with these challenges feel integrated into their community.
So it's not just about treating the symptoms, but looking at the whole person in their environment.
That's the goal.
That makes a lot of sense.
There's also a really strong financial argument for focusing on primary care.
Oh, how so?
Well, treating mental disorders in primary care settings is often more cost-effective than specialized psychiatric care.
Okay.
Plus, and this is important, it takes a more holistic approach to treatment because it acknowledges that mental and physical health are deeply intertwined.
Yeah, you can't really separate them.
You really can't.
They're two sides of the same coin.
Absolutely.
And this is where the report got really interesting for me. The treatment gap.
Oh, yeah.
Especially in low and middle income countries.
It's a huge problem.
The report says the vast majority of people with mental disorders in these regions get no treatment.
It's really concerning.
It is.
The numbers are pretty shocking, actually.
Can you give us some examples?
Sure. So the report cites a 67% treatment gap for major depression in Africa,
Wow, 67%.
compared to 45% in Europe.
That's a big difference.
It is a huge disparity.
And I imagine even in wealthier countries, there's still a significant number of people who aren't getting the mental health care they need.
Oh, absolutely. There's a gap everywhere.
So what's causing this massive gap in treatment?
Well, there are a few factors at play.
Okay.
For one, primary care workers aren't always detecting these disorders.
They might not be trained to look for them, or they might be focused on the physical symptoms that the patient is presenting with.
That's right.
And then, of course, there's the stigma surrounding mental illness, which can prevent people from seeking help in the first place.
It's a huge barrier.
It is.
And then there's the issue of access to psychotropic medications.
Right. Those can be expensive.
They can be, and they're not always readily available in all parts of the world.
And on top of all that, there's the ongoing struggle with insufficient resources for mental health care.
Yeah, funding is a major challenge.
Okay, let's shift gears for a moment and talk about mental health and human rights.
Okay.
The report tells the stories of 2 people, Juan from Chile and Daya from Zimbabwe,
I remember those.
to illustrate the profound impact that integrated primary care can have.
It's powerful stuff.
It
It
is.
goes beyond just stats and policies
Right.
and shows the human cost of inadequate mental health care.
Yeah, it personalizes the issue.
Exactly.
Juan's story is particularly powerful.
It's a tough one.
He had schizophrenia for years.
And before integrated care was available in his community,
Yeah,
his experience was really harrowing.
I can imagine.
He was in and out of psychiatric hospitals.
Oh, that's hard.
And tragically, he experienced multiple human rights violations.
That's awful.
It's heartbreaking to think about what he went through.
It is.
But thankfully, his story takes a turn for the better when integrated primary care is introduced in his community.
That's good to hear.
His condition stabilizes.
That's a
He
great.
reconnects with his family.
Oh,
And most importantly, he finds happiness.
that's what it's all about.
It really is.
That's the transformative power of integrated care.
It can make such a difference in people's lives.
And Daya's story is just as moving.
Hmm.
She was diagnosed with HIV/AIDS while pregnant,
Oh, wow.
and understandably, she fell into a deep depression.
I can only imagine.
Thankfully, her primary care worker recognized her depression and started treatment right away.
That's so important.
It is.
It highlights the importance of having those trained eyes and ears on the front lines.
Absolutely.
And her primary care worker also connected her with some vital community resources.
So it was a really holistic approach to her care.
It was.
All right, let's move on to some real-world success stories from different parts of the globe.
I'm ready.
The report showcases several models, each with its own unique approach.
That's one of the things I find so fascinating about this topic.
Me too. It's not a one-size-fits-all solution.
Nope.
Let's start with Chile.
Okay.
In the Macul district of Santiago, they have a multidisciplinary approach
I've read about that one.
where general practitioners, psychologists, and community volunteers all work together.
It's a true team effort.
It is, and it seems to be working really well.
They're seeing great results.
So tell us how it works.
Well, the general practitioners are trained to diagnose mental disorders,
Okay.
and they can prescribe medications when needed.
So they're really equipped to handle those initial stages of care.
Yes, and then the psychologists offer individual, family, and even group therapy.
So there's a range of options depending on the patient's needs.
Exactly, and the community volunteers provide crucial support outside of the clinical setting.
It sounds like they've got all the bases covered.
They do. It's a really comprehensive approach.
What about other approaches?
Well, the Islamic Republic of Iran has a nationwide program where they train general practitioners to provide mental health care as just a routine part of their work.
Wow, so they're really integrating it into the fabric of primary care.
They are. And community health workers play a big role too, especially in rural areas.
That's smart.
They're often the ones who identify people who need help
Okay.
and then refer them to primary care.
So they're like the first point of contact.
In a way, yes.
I like that. It addresses the access issue.
It does, especially in those harder to reach rural communities.
What other models stand out to you?
Well, South Africa's Elanzeni district has two distinct models, which is interesting.
Oh, tell me more.
So in some clinics, they have dedicated mental health nurses, while in others, all primary care workers are trained to manage mental disorders as part of a holistic approach.
Wow, so they're experimenting with different approaches to see what works best in different contexts.
Exactly. It shows how flexible this integration concept can be.
I love that adaptability.
Yeah, it's not one size fits all.
What about Uganda?
In Uganda's Simbabule district,
Yeah.
they have a system where primary care workers are trained to identify and treat common mental disorders,
Okay.
manage emergencies, and refer complex cases to specialists.
So they've got a clear process in place.
They do, and importantly, they get ongoing support and training from specialized outreach services.
That's crucial
It is.
because it ensures that they have the knowledge and confidence to handle these situations.
Yeah, exactly.
What about Australia?
Australia's model focuses on shared care and case management, particularly for older adults.
Okay.
So general practitioners, old age psychiatrists, and psychogeriatric teams all work closely together to make sure older adults are getting comprehensive care.
That sounds incredibly well coordinated.
It is. They really prioritize continuity of care,
Mm.
which is so vital for older adults who often deal with multiple health issues, both mental and physical.
It's a really vulnerable population.
It is.
These are just a few examples from the report.
Yeah.
But it's inspiring to see so much innovation and dedication to tackling this issue around the world.
It really is.
So let's look for some common threads here.
Okay.
Based on these case studies,
Yeah.
What are some of the must-haves for successful integration?
Well, strong political commitment is at the top of the list.
That makes sense.
You need dedicated champions at both the national and local levels to make this happen.
To drive the change.
Yes, and those champions need to be able to secure funding and overcome resistance.
So it's about having people in positions of power who are truly committed to mental health.
Exactly. And then you need adequate training and support for primary care workers. We can't expect them to take on these responsibilities without giving them the knowledge, skills, and ongoing supervision to do it well and to do it confidently.
It's about investing in their expertise.
It is.
And ultimately, investing in the well-being of their patients.
Exactly.
And what about medications?
Access to essential psychotropic medications is another must-have.
Right.
We need to make sure these medications are available and affordable in primary care settings.
Especially if we're serious about closing that treatment gap.
Absolutely.
What else?
Clear referral pathways are crucial.
So if a patient needs more specialized care, there's a smooth process for getting them to the right place.
Exactly. Seamless coordination between primary care and specialists.
Making the system work for the patient,
Right.
not the other way around.
Exactly. Community involvement is key.
Yes.
Engaging patients, families, and community organizations helps reduce stigma
Right.
and creates a more supportive environment for people facing mental health challenges.
It takes a village, as they say.
It really does.
Okay, we've talked about the keys to success, but as with any major change, I'm sure there are some challenges along the way.
There are always challenges.
What are some of the roadblocks that we need to be aware of?
Well, one common challenge is resistance from mental health specialists.
Oh, how so?
Some might see integration as a threat to their professional status,
Okay.
or they might worry about the quality of care being compromised.
That's understandable. Change can be unsettling.
It can be, especially when it involves long-standing practices and professional identities.
People get attached to the way things have always been done.
They do.
What else?
Another challenge is hesitation from primary care workers themselves. Many already feel overloaded and might not have the confidence or time to take on more responsibilities.
Yeah, it's a lot to ask.
It is, and time constraints are a major factor.
Given how demanding primary care already is.
Exactly.
And then, of course, there's the issue of inadequate funding and resource allocation without proper investment. These integration efforts are likely to fail.
It all comes down to money in the end.
It often does. It's about putting our money where our mouth is.
Right, showing a real commitment to mental health.
Not just talking the talk.
But walking the walk.
Exactly.
And finally, we can't ignore the ever-present challenge of stigma.
Ugh, stigma.
It's a huge barrier to seeking help.
It is, and it can even affect the quality of care that people receive.
Absolutely. We need to keep working to break down those harmful misconceptions about mental illness.
And promote open conversations about mental health.
Yes, it needs to start early too.
In schools.
In families.
In workplaces.
Everywhere.
It's everyone's business.
It really is.
Okay, we've covered a lot of ground in this first part of our deep dive.
We have.
We've looked at the huge burden of mental disorders worldwide.
It's a global issue.
How vital primary care is in closing that treatment gap.
And how integrated care can make a real difference in people's lives.
Yes, and we explored some real-world success stories.
There are some amazing things happening out there.
We talked about what makes integration work.
And the challenges that need to be addressed.
We're just getting started.
Ready for more.
In the next part of our deep dive, we're going to dig into how important cultural sensitivity is in mental health care.
That's so important.
And we'll look at some practical tools and strategies for navigating the complexities of integration.
I'm looking forward to it.
Stay tuned.
We'll be right back.
Welcome back. You know, as we get further into this,
Yeah.
I'm really struck by how important cultural sensitivity is in mental health care.
Oh, absolutely.
Especially given all those diverse global examples we've been talking about.
It's crucial.
Cultural context shapes how we experience and understand mental health challenges and even how we seek help.
Yeah, totally.
What might be a normal reaction to stress in one culture could be interpreted completely differently in another.
That's right.
And I imagine that has huge implications for diagnosis and treatment.
Oh, it definitely does.
The report actually highlighted a case in the United Kingdom
Yeah, I think I remember that one.
where a lot of patients from minority groups felt that their treatment and diagnosis would have been different if their healthcare provider truly understood their background.
And their experiences.
Exactly.
That's a real problem.
It's concerning, but not surprising.
Unfortunately.
We need to ensure that mental health care is truly inclusive,
Yeah,
responsive to the diverse needs of our communities.
absolutely.
It's about making everyone feel seen and heard.
That's the goal.
The report mentions a tool that could be really helpful here.
I know which one.
It's called the Cultural Awareness Tool.
Right.
And it's designed to guide primary care workers in understanding their patients' beliefs and perspectives on illness.
Including mental health.
Yeah.
It encourages providers to ask those open-ended questions.
Like what?
Like, what do you think caused your problem?
Oh, interesting.
Or, within your own culture, how would you typically be treated for this?
So it's about moving away from assumptions and really listening to the patient's story
Absolutely.
and understanding their unique perspective.
It also emphasizes the importance of involving family and community support systems when appropriate.
Oh, that's a good point.
Because in many cultures,
Yeah.
mental health isn't just an individual issue.
Yeah.
It's a collective one.
It affects the whole family.
The whole community sometimes.
And I imagine that can be incredibly valuable
It can be.
in reducing stigma
Yeah,
and fostering a sense of shared responsibility for well-being.
exactly.
Okay, so we've established that integrating mental health into primary care is essential, but it's complex.
It is.
What specific steps can healthcare systems take to actually make this integration a reality?
Well, it really starts with education and training.
Okay.
Mental health needs to be woven into the fabric of medical education
From the very beginning,
from day one,
for all healthcare providers.
not just specialists. And that training needs to be ongoing throughout their careers.
Keeping their knowledge up to date.
Absolutely. It's a constantly evolving field.
So making sure that mental health isn't treated as something separate,
Right.
but as a core part of overall healthcare.
Exactly. And the training can't just be theoretical.
No, it needs to be practical.
Hands-on.
Yeah.
Healthcare providers need to know how to conduct mental health assessments, understand different diagnostic systems,
Right.
and even how to deliver some basic psychological interventions.
So they feel confident and competent.
Exactly. And it's also crucial to provide healthcare workers with the tools and resources they need to take care of their own mental well-being.
Oh, that's so important.
It is. They're on the front lines.
Dealing with a lot of stress and trauma.
Exactly. They need support to thrive in these roles.
What else can healthcare systems do?
Developing clear guidelines and protocols for mental health care within primary care settings is essential.
So providing a roadmap for consistent, high-quality care.
Precisely. These guidelines should cover everything from diagnosis and treatment to referral pathways and follow-up procedures.
Okay.
And importantly, they need to be adaptable to different cultural contexts and resource limitations.
Right. One size doesn't fit all.
Yeah.
We were talking about cultural sensitivity earlier.
Yeah,
This seems like a place where that really comes into play.
it does. And it's not just about culture, but also about the resources that are available.
In different settings.
Exactly.
What about technology?
Oh, technology can be a game changer.
How so?
Well, think about telemedicine.
Okay.
It can massively expand access to mental health care, particularly in rural or underserved areas.
Where specialists might be few and far between.
Exactly. It breaks down those geographical barriers.
Getting care to the people who need it most.
We're also seeing the development of some really cool digital tools,
Like what?
like mental health apps and online platforms that can provide support, resources, and even therapy.
Wow, that's incredible.
It is, but we have to make sure these advances are being used responsibly and ethically,
Of course.
with a focus on data privacy and accessibility for everyone.
Right, technology should be a tool for good.
Exactly.
We can't talk about integration without talking about funding.
True.
How can we ensure that mental health care is adequately funded within primary care settings?
Well, it starts with prioritizing mental health in national health budgets.
Making it a priority.
Yeah, and making sure resources are allocated effectively to support primary care services.
Putting our money where our mouth is.
Exactly. And we also need to advocate for reimbursement models that actually value mental health care delivered in primary care settings.
Recognizing that mental health is health.
Couldn't have said it better myself.
And finally, we need to tackle stigma.
Yeah,
It's such a huge barrier to seeking help.
it is. And it can even affect the quality of care that people receive. Absolutely.
We need public awareness campaigns to challenge those harmful misconceptions about mental illness and promote open conversations about mental health.
This needs to happen everywhere.
Schools, workplaces, community organizations.
All of them.
It's about changing societal attitudes,
Yeah.
recognizing that mental health is everyone's business.
We all have a stake in this.
Okay, so we've outlined some concrete steps, but I imagine there are still some built-in tensions
Oh, yeah,
in this integration process,
definitely.
particularly between primary care and specialized mental health services.
There can be some friction there.
What do you mean?
Well, some specialists might feel that primary care providers aren't equipped to handle complex mental health cases.
Right, and I bet some primary care providers feel overwhelmed by the thought of taking on these extra responsibilities.
That's understandable.
It's a big ask.
It is. That's why clear communication and collaboration between these two sectors is so important.
Working together,
Not against each other.
building bridges, not walls.
Exactly. And recognizing that both sectors bring their own strengths and expertise to the table. Specialists can provide those specialized assessments and treatments, and they can offer training for primary care providers.
Right.
And in turn, primary care providers can offer ongoing monitoring, support, and early intervention.
Within a setting that's familiar and accessible for patients.
Exactly.
It's about teamwork, ultimately.
It is.
Working together to provide the best possible care.
And it's important to remember that integration isn't a destination.
Oh, that's a good point.
It's a journey.
Yeah.
It requires continuous evaluation, adaptation, and a willingness to learn from both our successes and our challenges.
I like that, embracing a continuous improvement mindset.
That's it. And recognizing that as the needs of our communities change,
Yeah,
our healthcare systems need to change along with them
we have to be adaptable.
and responsive.
So we've explored the why, the what, and the how of integrating mental health into primary care.
We have.
What's the key takeaway for our listeners?
The most important message is that integrating mental health into primary care isn't just a nice to have,
Right.
It's a must have.
Essential.
It's about recognizing that mental health is a fundamental part of overall well-being.
And everyone deserves access to quality, compassionate care.
No one should be left behind.
It's about creating a world where mental health is no longer stigmatized,
Yes.
where seeking help is seen as a sign of strength, not weakness,
Absolutely.
and where people can get the support they need when and where they need it.
Without shame or judgment.
Exactly. It's about building a healthier, more equitable, and more just world for all.
A world where mental well-being is valued and supported.
It's been quite a journey, hasn't it? Exploring this whole world of integrated mental health care.
It really has. And I got to say, I'm feeling pretty energized by all the possibilities we've uncovered.
Me too. But as much progress as we've seen, we can't just sit back and think the job's done.
Oh, absolutely not. There's still a ton of work ahead.
So let's give our listeners something to really chew on, a question to take away with them.
Okay, I like that.
Considering what you've learned today and what you already knew about your own community,
Yeah.
what kind of innovative approaches to mental health integration do you think would really work where you are?
That's a fantastic question to get the wheels turning.
Right.
I mean, we've seen some amazing models from around the world,
We have.
but there's always room for more fresh thinking,
Absolutely.
for taking those ideas and making them fit different settings.
Because one size definitely doesn't fit all.
Nope.
Each community has its own unique context,
Its own challenges.
its own resources.
Its own opportunity.
What works in a big city might not work in a rural town.
Exactly. So maybe it's about finding new ways to use technology,
Like what?
like maybe telehealth platforms to reach people in remote areas where it's hard to access specialists.
I like that, breaking down those barriers.
Or what about building stronger partnerships between healthcare providers and community organizations
Oh, that's interesting.
to create more comprehensive support networks?
So it's not just about the clinic. It's about the whole community wrapping around someone who's struggling.
That's the idea.
I love that. And I think we need to be willing to think outside the box.
Definitely.
Maybe it's about looking at traditional healing practices that already exist in a community and figuring out how to blend those into a more holistic approach to care.
You know, that's something I'm really passionate about.
I am too.
We need to honor and value those different perspectives and approaches.
It's about recognizing that wisdom exists everywhere.
It does.
And ultimately, I think it's about empowering communities to take ownership of their own mental well-being.
Absolutely. Giving them the tools and the support they need to thrive.
So to everyone listening, I
Yeah.
really encourage you to keep digging into this topic.
It's so important.
Go back to the source material we mentioned, the WHO report, the other articles.
Yeah.
Explore the areas that really sparked your interest.
And think about how you can be part of this movement.
Right. For more accessible,
Well, inclusive.
more effective mental health care.
Everyone can play a role.
What skills do you have that you could offer?
What connections can you make?
What unique perspective do you bring to the table?
Don't underestimate your own power to make a difference.
This deep dive has been a starting point,
A jumping off point.
but the conversation needs to continue.
Research needs to keep expanding.
And we need more people who are
Absolutely.
committed to making real change happen.
Because at the end of the day, mental health is everyone's business.
It really is.
It affects every single one of us.
And we all have a role to play in creating a world where mental well-being is truly valued, supported, and nurtured.
So well said.
We'll make sure to include some resources in the show notes.
So you can keep learning and exploring.
Thanks for joining us on this deep dive
It's been a pleasure.
into the world of integrated mental health care.
Until next time.
Take care of yourselves.
And each other ourselves.